Okay, thank you very much. And a good afternoon. I'm aware I might be standing between you and your lunch break, so I'm going to make it very brief. And just as the team from the core project indicated, led by Dr. Caro and Richard, the core project brought an aspect that we are engaging in called community engagement and involvement. Not a new concept in Kenya. It's based on the public participation model in governance. And community engagement and involvement has some very good kind of rewards if well taken care of. So we are sharing some experience and work that we've done at Makueni County on community engagement. And I'm looking at the collaborators. You've seen them here, so I don't have to speak about them. The core project, a 4-year project, definitely aiming at addressing the neglect of oral diseases in LMIC countries. Started us off with an exercise that was community mapping, where we did enter communities to establish what community assets, what healthcare provides is like for oral health, and who is there as a partner, who is there. And so through that whole exercise, we sat down with communities and were able to quickly begin to understand what are the issues on the ground. I must say I do not go there as Professor Mutave, but I went there as a community member. Somebody said that when we go to the community, we just dress like the community so that we can walk with them and sit and listen together. And so interacting with Makueni community, a small community, we were able to pick out that there's a big problem around cultural practices around oral health, and which is the reason we are sharing with you in this particular forum, that we have a small community that we work with at Kisau Kiteta Ward in Baonik sub-county of Makueni County. And once we were able to find this cultural practice that some of you may have heard of, we talk about infant oral mutilation, and we think it's in the Maasai, it's in other places. But when we went there, we found it was a big issue. Interacting in communities, you must bring everybody in the community who matters. A lot of times we think it's an issue of women groups, but no, you find out what community-based organizations are in that place, you engage with them. You try and talk to the men, because the power interplay in the community needs to be understood well, and know who wields the power, who wields the real decision-making power in a community. And so this practice emerged as a concern. It emerged that the power is wielded by the older women, not even the mothers of the children, and that husbands and fathers had a big role, because once they said is done in their family is what exactly will be done. And so we thought that talking to communities and gaining their trust to the level that they can actually be able to open up and share their deepest practices without fear was a big plus. We involved communities in open dialogue, where they could lead the conversations and we are just participants. And that provided some empowerment to them, that they could actually be able to say, yes, this is done, when they knew it was wrong, and they did not know where they could go for a solution. Because if a mother says, I don't want my child to be exposed to that, and the more powerful grandparents insist, that child will still have infant oral mutilation done. And I am saying that working with communities, once you can be able to gain trust, it is possible to have a very, very inclusive engagement, regardless of who it is, whether it's the youth, the young people, So we have specific community forum members who are actually talking to the communities and leading the conversation, as I said, not us. And this particular forum you see is actually being led by a community member, not ourselves, and they come together and discuss. We brought them together, but they take forward the talking, the discussions of the issues that are affecting them. And yes, we also at times organize outreaches to be able to pass information and create some awareness. And at some point, we were able to bring on board the World Oral Health Day. We negotiated, and thank you to Ministry of Health, when we managed to get a bigger traction of the county leadership. We still talked about the issue affecting the community, brought it to their fore. And let me say that subsequently, we have had media outreaches that have also talked about the same issues, demystifying cultural beliefs around IOM, making sure that community members understand why it's wrong, and looking for a way of saying, yes, let us have some action. So 2 media outreaches were done at the request of the very community, that the persons who arranged that I go and talk in Kamba to the media outlets was actually a member from this very community who had influence. So just using the power of the community within. And so we did that before the World Oral Health Day. The county of Makueni requested that we talk to their non-oral health personnel. Again, it's the county acting, not us, but us facilitating. And so we looked for a speaker, and we got somebody who is very passionate about IOM, Dr. Alice, and I hope she's around. Thank you. She accepted to talk to the non-oral health workers of community of Makueni County, and they were able to have a whole 117 non-oral health practitioners attend the webinar. So we thought maybe let's escalate this and give it another go at the national level. And some of you know that we were talking to on the platform of Kenyatta National Hospital webinar series, and we got exceptional interest nationally. And I think a few of them signed up from Sudan and Somalia, 900 plus attendees for that webinar. So it is an issue that is not just local, but it seems to have, of course, we know there are many other areas that do infant oral mutilation. And basically, what we are trying to do is bring IOM to the policy intervention level, make sure that the county policymakers are at the table, and try to uncover all the practitioners. And the county of Makueni has actually taken a little step forward and they're even trying to find alternative livelihood for some of those traditional practitioners, so that we can try to have a multi-pronged action to try and reduce this action. A few of you get surprised that IOM is happening in this 21st century, and it is. It is our job to try and look for avenues to really work with communities and try to scale up the campaigns to other counties, and then we can be able to eradicate the practice. I want to thank you very much. It is really a great pleasure talking to you.